Hello, and welcome to this Child Mind Institute webinar. This is an introduction to brief behavioral activation for adolescent depression. In this presentation, I, Dave Anderson, Senior Clinical Psychologist at the Child Mind Institute and our Vice President of Public Engagement and Education, going to talk to you a bit about adolescent depression, some of the thorny issues in treating adolescent depression, and why treatments like brief behavioral activation offer an incredibly good, kind of time-limited solution to some of those thorny issues with adolescent depression. And following that, my colleague Julia is going to introduce a product through our next generation digital therapeutics division called Kandoo that makes brief behavioral activation infinitely more engaging for adolescents who already might be having a little bit of difficulty engaging with treatment, and at the same time, incredibly useful and easy for therapists. So, with that, just a bit of introduction about who we are at the Child Mind Institute. We are a nonprofit with offices in California, New York, and Athens, Greece. Our focus is on three major pillars of care, education, and science. While we provide care in and around our offices in New York, San Francisco, and via telehealth, you can see some of the stats there on our clinical care over the last year. We're currently recording this in 2025. So for those of you watching this in 2036, we may be much larger in terms of number of clinical visits, but this is our current cross-sectional data. We're focused as an organization on public education. So our website, childmind.org, has around 2 million visitors per month for free resources, toolkits, and trainings. We have hundreds of articles, not to mention there is a longer training on content like what we're presenting today on our website that you can actually access. And then across our science team, our focus is on objective markers of child and adolescent mental health and learning disorders, sharing our data and collecting large data sets that we share openly with the world so that we can save money, make discoveries within our lifetime, and help to transform youth mental health for everyone, whether you live in the United States or any of the countries that we work with through our global programs. So we have an exciting kind of scope of work, but today I want to focus back down on the notion of how we can use digital tools to accelerate and enhance outcomes with adolescent depression. Just to set the stage a little bit in terms of facts about adolescent depression, depression is one of the most common and impairing psychiatric disorders of the teenage years. One of the main reasons why we see it kind of surface during this time is A, your body's changing hormonally and in the transition to adulthood via puberty. We then see also that this is a major kind of focus during this developmental stage on identity formation. So folks are kind of figuring out who they are to other people, who they are to their peers, who they plan to be in life. And that can involve a lot of ups and downs. What we see is that there's an increased focus on your peer world and the world of romantic relationships and navigating your kind of social sphere, moving independently and autonomously away from family and trying out new things and taking new risks. And at the same time, it's already a developmental period associated with a certain level of moodiness. And for some teens, that can get a little bit more extreme in terms of the moods that they experience. When we look at adolescent depression, we look at the data and the research. The median age that we see where it has an onset, which means that it appears, is 14 years old. By the time kids reach 18, about 1/4 of kids will have experienced a depressive episode. At any moment, if we just take a sample of any number of teenagers, this is what point prevalence is, what we tend to see is about 8 to 10% might be reporting some form of depression, with 3 to 5% demonstrating some level of severe depression. This is one of the main reasons why, within the midst of the youth mental health crisis that we are currently embroiled in, depression is one of the major areas that we focus on because depression can be very severe during adolescence, and it can also be very much associated with danger and risk in the sense that suicidality, suicidal ideation, and self-harm can be associated with depression, and that can be one of the main things that lands a teen in the emergency room or that might lead to an event where a teen makes an attempt on their own life. So we want to focus on this and make sure that we have incredibly effective and engaging treatments for it for adolescents. So part of the reason why treatment can be really difficult with adolescents is that first, during the adolescent developmental period, the prefrontal cortex is coming online, which means that that part of the brain that dominates as kind of the sort of chair of the board or the leader of the organization, the seat of executive functioning, may not necessarily be functioning as efficiently as it might in the later years of our life. So as much as a teen might need to organize and plan and think ahead as a way of navigating themselves out of mood episodes, this is an area of the brain that's still under construction at this developmental stage. Beyond that, we know that when we look at the kind of challenges that's this developmental phase, when teens experience, peer challenges, these are some of the first times that they've experienced those challenges, whether it be their first romantic relationships or experiences of peer rejection or not being included or being included in a particular group. And so that level of like loneliness or heartbreak may be experienced both more vividly and for the first time, which means you're not really well habituated to it, and it can feel to you even more painful than it might at later stages of development. What we also know about why treatment can be difficult is access challenges, and this is true across the United States. Uh, there's a lot of stigma and shame associated with symptoms of depression, feeling from teens that, like, given their life, that things should be a lot easier in terms of what is happening. Like maybe a teen will look at their life and say, "Well, look, you know, I at least have friends, or I've got a supportive caregiver, or I am dating, or something like that. Like, why do I feel this way? I shouldn't." There's also the fact that when teens are depressed, they often hide it from those who care about them the most. And so those symptoms might get missed. Beyond those issues with access, there's a limited number of professionals. A wide range of teens across the United States live in treatment deserts where there aren't enough trained mental health professionals. And particularly in communities of color or in diverse communities, there aren't enough trained professionals who represent those communities and who teens feel really understand their life experience. Geographically, as I said, there's millions of Americans who live nowhere close to medical and mental health services, and then beyond that, we also have economic issues with access. In that insurance parity is not necessarily always in place for mental health services. Kids may have access to some degree through their insurance, but even the treatment they have access to may not be covered for a long enough period of time to be effective. Or beyond that period of time where it's covered, people may not have the ability to pay, or they may find the mental health professionals in their area are too expensive. Beyond that, so we already have developmental challenges, we have challenges with access, but for teens, what we also see is that there are depression specific challenges in the sense that the symptoms of depression that we see in teens, so commonly this low mood, or we call anhedonia, which is finding that activities that you used to think were really fun or pleasant are now no longer seeming as reinforcing or as fun, and you find lower motivation or energy even to engage in those activities. Not to mention that, during an episode of depression, what we might see is that a teen is feeling more lethargic, they're sleeping more, they're perhaps spending more time alone. And all of those things lead to a certain withdrawal from their lives that can make it that much more difficult to engage them and get them, kind of motivated and participating in treatment. So, with all of these challenges, we want to think, how do we choose treatments that address the key developmental hurdles of adolescence? And then what you're going to hear a little bit later in this presentation is, once we've chosen that treatment, can we even utilize the digital tools available to us to make this even more engaging for teens and for their therapists to be able to engage in this work collaboratively? So, as I was saying, when we look at how teens experience depression, that feeling of being low or sad or kind of not finding pleasure in the things that you would normally like to engage in leads to a really vicious cycle for a lot of teens where they feel that way. So then they do less of the things that either matter to them or that might boost their mood. They get less rewarded by those things, not to mention that they may also be experiencing rewards outside of this cycle from activities that are not helping to break the cycle of depression, but might feel good in the moment, like staying in bed, or as the teens say today, bed rotting, scrolling a lot on their phones, sleeping a lot more. The issue is that those activities, first, you're withdrawing from the things that might boost your mood. And then, secondly, you are engaging in activities that when you kind of come up for air or when you take a break from those activities, teens will often report they feel even worse because they feel like they didn't do anything or they weren't doing something that really engaged with life or with their peers or school or extracurriculars or with their family. So, in thinking about how we break this cycle, one of the frontline interventions for teenage depression is what we call behavioral activation. Because the theory behind behavioral activation is, if depression is maintained by withdrawing from activities that you'd find rewarding or mood boosting, and at the same time, that kind of withdrawal keeps reinforcing the very things that are symptomatic of depression. If we can get a teen to increase their engagement in positive, rewarding activities that are consistent with their values or their objectives in life, we can reduce their avoidance. We can reduce their inactivity or make them more active. And what we'll notice is that we start thinking and feeling differently when we activate, that aspect of our behavior. So, behavioral activation obviously is one central facet of adolescent depression. But one of the keys that we see in the research is that when we look at response rates from typical treatments for adolescent depression. So, if you're doing cognitive behavioral therapy, or if you're doing, for example, dialectical behavioral therapy, you might see within the research a 55, 65% response rate amongst teenagers to those treatments. It might be similar for medication, and it might be boosted by 10 or 15% when you combine medication and one of these psychosocial treatments. What's interesting about behavioral activation is that when you take this aspect of intervention and you make it even briefer and more targeted, we can actually see an increase in response rate compared to studies of traditional CBT or DBT for depression of about 10 to 15% on par with what would already be combined medication and cognitive behavioral treatment. So, this is where brief behavioral activation, what the research suggests, given that response rate, is that this might be well titrated to the challenges of adolescence and to the particular kind of ways that we need to activate an adolescent quickly and in a time limited fashion to keep them engaged with treatment in whatever time we've got when there might still be some optimism that treatment is going to have an effect. So, this is where brief behavioral activation comes in and applies the principles of behavior activation in this time limited structure that is simple, it's transparent, it doesn't rely too much on the teen's executive functioning to be able to do. And as you're going to hear when we introduce Kandoo, we can actually even take the demands on the teen's executive functioning even lower by putting this into a digital therapeutic that does a lot of the work for the teen organizationally. At the same time, the way that brief behavioral activation really targets some of the things that are going on in adolescence is it helps a therapist and a teenager to take a critical look at how an adolescent is spending their time, what would be important to them and how they spend their time, and what's consistent with their values, and then how they can use sports around them to activate themselves quickly and efficiently to start climbing out of that depressive hole that many of us find ourselves in the midst of a depressive episode. So, put more simply, we help a teen to identify their values, and these could be values associated with how they want to live their life, how they want to interact with other people, the activities they do in life, what they feel are valuable activities. And so we'll go through these large checklists where we identify what activities these might be, activities that take a short amount of time, activities that take a longer amount of time, activities that you can do alone, activities that are dependent on other people, and how those activities might get you closer and closer to your goal. And by scheduling time to do those things and really structuring how we engage with those activities, we find that we decrease avoidance. We're filling more time with valued things. And as we do things differently, we see that as a result, and this is kind of a cognitive triad of thoughts, feelings, and behaviors, as you target that behavior vertex, you notice that you start thinking and feeling differently. So, what it tends to look like is something like this, where the vicious cycle of depression that I outlined earlier, where someone might feel low or sad or flat, and then does less, gets less reward, and continues to feel low. Instead, we start doing a bit more of what a teen identifies as what matters to them. They start to feel like their mood can improve bit by bit and that they're getting a little bit more out of life, that they're feeling a little bit more fulfilled, they're feeling a little bit better about themselves, their mood is lifting even slightly. And the more that we can keep that cycle going, the more likely we are to see the teen maintain the work of brief behavioral activation even after the short duration of treatment. Another reason why brief behavioral activation can be so effective is that the therapist client relationship in brief behavioral activation models what we want to see that teen doing in real life. So the therapist in the session is engaging with the teen, helping to coach them in the kinds of cognitions that'll help them to engage in brief behavioral activation outside of the session, encouraging them the same way we want them to do self talk with themselves, and reminding them of the rewards of these activities that they're engaging in, and kind of reviewing and making sure that a teen kind of assesses how much those activities feel different than perhaps what was maintaining their depression to begin with. And so, as we provide the encouragement for this kind of anti-depressed behavior and validate their efforts, we see that cycle hopefully mirrored in the teens' thoughts and approach to brief behavioral activation outside of the session. So, looking at what the core components look like across a course of brief behavioral activation, which may only be on the level of a couple months in terms of how long this treatment might last, which itself is already, you might say, a month or two shorter than a typical treatment course of, say, cognitive behavioral therapy. The focus is get in, get the stuff that really matters, that's going to have the most outsized effect on depression symptoms happening, and then help a teen to set up that structure for maintenance and social support that allows them to continue making these gains outside of therapy. So, what we look at with brief behavioral activation is how can we psychoeducate around what is going to be most helpful for a teen. We're teaching about the links between mood and behavior and thoughts. We're talking about this kind of notion of the vicious cycle of depression. Then we're identifying what values and goals really matter to a teen. Then we're thinking about which activities might be aligned with those goals and how we can track and schedule time for those activities, how we can attack avoidance patterns together and keep that reinforcing cycle going as we schedule the activities and notice that we're increasing in frequency week to week. Then as we target that, avoidance, we're really thinking what kinds of things cause us to avoid behaviorally activating, and how can we not only promote the behaviors that we know are mood boosting, but also decrease the behaviors that we know might maintain the symptoms of depression. All of that is framed in terms of problem solving in any given week and thinking about how we can use the supports that we have outside of the session, even if we've got kind of mixed feelings about using those supports. And in terms of building this for autonomy for the long term, how can we help a teen to think about relapse prevention? Once we climb out of that hole that is associated with the low mood or the anhedonia or the irritability of teen depression, how do we help a teen to know as we kind of conclude this course of treatment what the warning signs might look like next time? Now they can activate themselves while they still might have a bit more motivation than where they may have found themselves, say, at the outset of treatment when they were really deep in the hole. And that's an incredible aspect of self knowledge that we can arm a teen with and help them to feel like they're better equipped for any future vulnerabilities, be it seasonal or related to breakups or friendships kind of going up and down or whatever other challenges they might face across their development. So, with that, I want to pause there. We've reviewed a bit about kind of how some of the aspects of adolescence become really thorny in treating teen depression. We've talked a bit about the research and the kind of structure of brief behavioral activation and why this can be such an effective treatment for this age range. And now we want to make sure to introduce to you is a tool that you can use at your disposal to then increase even the effectiveness and engagement with brief behavioral activation through a tool called Kandoo. And here is my colleague Julia to begin telling you about that exciting tool.
Perfect. Great. Thank you so much, Dave. I'm Julia Trabulsi. I'm the Director of Product at the Center for Product Development at the Child Mind Institute. And I'm responsible for helping to build out digital apps that help scale the solutions that Dave is talking about. One of those is Kandoo. This is a digital app that we built to help take what Dave is talking about for brief behavioral activation and pull it into the modern world. Patients can participate in brief behavioral activation in a way that's really easy for them and it keeps them motivated. Traditionally, we do brief behavioral activation treatment with paper and pencil, but you can imagine how that might not translate into the modern world very well. Teens don't always keep with them a paper and pencil, and they might forget their paper while they're trying to track the activities that they would do. These are activities that they've agreed on with their clinician that they'll do throughout the week to kind of stay motivated and keep out of that cycle of depression as they do more of what matters. In Kandoo, this is an app that they can use to track all of those activities. So, in the modern world, they're carrying around their phone, and it's designed for those young people who are working with behavioral activation therapy so they can always log their activities and their value based activities when they are on the go. I'll show you what this looks like on the next slide. We'll start with the clinician side of Kandoo. For clinicians, they can easily enroll their patients into the Kandoo clinician dashboard. What's so great about this is that they're able to enroll their patients and also view what's happening within the app, how often their patients are completing their value-based activities, how many of those activities they've done during the week, how frequently, and also very importantly, which of those activities are actually increasing their mood the most. So then the clinicians can then tailor the treatment with the patient so they can assign them more of those activities that are actually providing that mood boost and get the most out of brief behavioral activation treatment. On the next slide, we'll go into the patient side of Kandoo. So while the clinicians see their dashboard, the patients have an app on their phone that's keeping them engaged. Once a patient is invited, they can download and sign up for the Kandoo app. And in the app, they're going to play a map based game with a companion where they'll log their activities, they'll track their value based activities, and they can even watch educational videos to learn more about brief behavioral activation and depression. Once they've completed their value based activities, patients will play an augmented reality mini game to get these in app rewards. So, not only are patients doing the things in real life that actually make them feel better, those activities that Dave had talked about, but they're also then getting motivated to log them in the app, which then allows their clinician to follow along with their progress, both kind of in between, but then also in session where they can tailor that treatment better. By logging this all in the app and bringing those two pieces together between the patient and the clinician, we get a more holistic view of how brief behavioral activation is working for the patient, and the clinician is better able to then activate that treatment and keep things going, especially in the direction that they want to be moving with the patient. On the next slide, I'll show you some examples of what the patient sees. So, on the first video, we can see that the patients start the game by choosing a companion to walk around the map with. They then go to the training gym in the second slide here in the second video. Then go to the training gym where they can log value-based activities. They're logging their mood to start. The very first thing they do is log their mood. How do you feel right now? Then they're logging their activity, and then they're logging their mood again. How do you feel now that you've completed it? This enables the clinician to see that lift in the activity, see that lift in mood after the activity. So then they can track which of these activities are the ones that are bringing them the most value for brief behavioral activation and which ones should we double down on as we continue our sessions. As you go to the next video, when people are completing their value based activities, they are then getting a reward. This is a crate that's going to flip and unlock. It's going to be the third video here, which we'll play in just a second. Perfect. So once they get their value based activities logged, they're going to get this reward. This is a crate. They're going to flip this crate. They're going to place it in their room. This is an augmented reality game. They'll place it in their room, find a spot for it. And then once it places, they will then play this mini game where they are flipping this crate upside down. Once they have flipped the crate and it landed up right side up, it will unlock and they will get a reward in the game. This reward could take the form of swag or points, various different rewards to keep them motivated and keep them going with the game. So they're not just, as I mentioned, not just getting the real world feelings of actually doing the activities, but they're encouraged to complete them in the app. They're encouraged to continue to do those activities because they're also getting those rewards in the app as well. So kind of a gamified element to keep people engaged. On the next video, we can see that there's also a way that they can watch videos to learn more about depression and brief behavioral activation treatment. These short form videos are built into the app. They're a really great way to take a break during the middle of their treatment. The videos range from educational videos about brief behavioral activation to educational videos about depression and anxiety. They let them know that they're not alone. We have some snippets of celebrities talking about their own depression. And then we even have calming videos like the one that's on the screen here, a sand Zen garden, just to take a moment to breathe and relax. All of these videos are a really great way to take a break, and they keep young people from going to the other vertically scrolling video content that might not be giving them the same kind of benefit. So it allows them to have that moment of Zen while they're also still learning and getting enriching video content. On the next slide, we'll share an exciting opportunity for how to participate in Kandoo, how you can use it. So, for a limited time, we are offering our brief behavioral activation e learning training, which is about a 3 hour long module that you can take to learn all about how to put BBA into practice in your day to day with your patients. So you can take that training, and then we also give you access to Kandoo to use with your patients, all completely for free as part of our community initiative. If you would like to participate and access these amazing tools for free, you can scan the QR code on the screen to learn how to sign up and participate in this early access program. We are really excited to get people enrolled in this. We would love to get people who are using our brief behavioral activation e learning modules and also using Kandoo in the real world so that we can help to learn how it's helping you. And with that, thank you so much for joining. We are so happy to share this information with you. Dave, I'll pass it back to you.
I would just say thank you for anyone who's listened up through this now almost exactly 30-minute webinar. We hope we've given you some stuff that you can use with your patients that maybe interests you in doing the longer brief behavioral activation training, and that we hear lots of feedback from all of you who are watching about Kandoo and how you're using it with your patients.